Are you a mother, father, or you are involved in caring for children? If yes, then listen to Ask the Pediatricians every Thursday by 10 a.m. for insightful discussion on popular child health topics such as dangerous child health practices, immunization, infant feeding, developmental milestones, and so much more. You also get to ask questions on these topics and listen to answers to real-life child health issues by a pediatrician. Ask the Pediatricians Foundation is devoted to health education and information of parents and caregivers of children in the community to support you in raising healthy children. Don't miss Ask the Pediatricians with Dr. Ganu because it's informative, educative, and interactive. Ask the Pediatricians Hour, the program for caring parents.
Hello, everyone, and welcome to a fresh episode of Ask the Pediatrician Hour. I am Bemi Salaboide. I'm a pediatrician, and today we'll be talking again about those important topics that have to do with the health of our children. I want to especially welcome every one of you from whatever platform you're listening to me. Special welcome to those of you who are listening on Fresh Waves Radio and or Ask Dr. Bimi ATP podcast. You're especially welcome. And for those of you who are also listening and watching at the same time on our Facebook pages for Ask the Pediatricians Foundation as well as Fresh Waves Radio, I want to say special welcome to you. And for those of you who are watching on our Facebook groups, you're also especially welcome. And I also want to welcome those of you who are watching us on the YouTube channel. So from whichever platform you are joining me this morning, or whichever time of the day you are watching or listening, thank you so much for tuning in to this broadcast. Ask the Pediatrician Hour is brought to you by Ask the Pediatricians Foundation, which is a non-profit organization that is committed to the health and welfare of children globally, especially in Nigeria and sub-Saharan Africa, where majority of our children are still dying from largely preventable conditions. And our goal, our mission is to actually reduce the number of deaths of children due to preventable causes. And we do that through health education and information on multiple platforms, including the one you are listening to right now. Also, we have our Facebook groups, we have our website, we have our YouTube channels, which are devoted to providing health education and information for parents and caregivers of our children. And of course, we also do community medical outreaches to indigent communities where they may not have ready access to health professionals like pediatricians or access to things like internet and smartphones to be able to watch our programs. So that's what we do on ATP. So welcome again. Thank you so much for joining us. And this morning, I'm going to be talking about special needs children. That's the topic of the day. And this is a topic that is very dear to my heart because my subspecialty is actually neurodevelopmental pediatrics. And that specialty is devoted to taking care of children with special needs. And as I always say, if you have any questions, feel free to email me your questions on askthepediatricians@gmail.com, or you can actually head over to our Ask the Pediatricians Facebook group. And we are there Monday to Saturdays to answer all questions that you may have. And for those of you who are listening on the radio, you can actually send in your questions through the Fresh Waves Radio WhatsApp details, and I'm sure they will get the questions to us, and we can always address those questions in subsequent episodes. The issue of special needs children is a big one. It's a large one. I'm not so sure whether I'll be able to finish it today. If I'm able to, great. If not, then I'm going to come back with part 2 of the broadcast. All right, so let's start. Who is a special needs child? This is a word that many of us we tend to use and we tend to throw around quite a lot. And sometimes when we use some words, they kind of get lost in the use of the words, and people don't really know what they mean. Even though it's a very common and very popular expression. So let's start by first defining what we mean by special needs child. Who is a special needs child? Of course, let's start by saying every child is special. Of course, all of us are special to our parents. Even as adults, we are still special to your parents. And so every child is special to God who created us. Okay, so all children are special. But in the context of my discussion today, when we talk about children with special needs, if you look at the dictionary, Merriam-Webster dictionary actually define a special needs child as a child who has mental, emotional, or physical problems that will require additional help or special setting when it comes to education. So these are children that need additional support in school, in different settings as a result of a particular either mental, emotional, or physical problems that they have. So they require more than what most other children who don't have those conditions we need. So it's basically another way of saying that children who need extra help because of their medical, emotional, or learning problems. So we tend to use those terminology for such children. So instead of mentioning each of the problems on my one, we just say children with special needs. So that is basically what it means. It's another way of saying children who have developmental disabilities, which could be range from mild to moderate to severe, and there are different kind of them as well. But any child who has any condition, whether physical, medical, emotional, mental, that requires additional help in school or educational setting, we tend to refer to such children as children with special needs. So the special needs, the help they may need may require the fact that they need to take medication in school, or they need to have some therapy in school, or even outside the school, or they need to have special education teachers and all that. So these are help that the average child in those settings will not need, but these children need those extra help. And so when children need special help, we refer to such children as special needs children, or children with one form of disability or the other. So that is the definition of special needs children. So for those of you who are listening, when I'm saying special needs child, that is the context in which we're using that terminology today. All right. So the question now is what are those conditions that will make a child a special needs child? What are those conditions that will make a child to need extra help in school? All right. So there are so many of these conditions. In fact, virtually all the developmental disabilities or conditions, as long as they are moderate to severe, means such children will need help. And so all such children will be classified as special needs children. So I'll just give some common examples. So children with cerebral palsy. Okay, so cerebral palsy is when children have difficulties with their mobility and posture. So some of those children are in wheelchair, some of them are not in wheelchair, but they require extra aids for walking and all that. And before I go far, I realize that especially for us in Nigeria and in Africa, where we don't have a lot of specialists who take care of children with these special needs, people sometimes don't know the difference between the various disabilities, and people tend to just refer to all the children with one name. So we hear people say, oh, the child has Down syndrome. Any child with disability, they just call them Down syndrome. Not every child with disability is a Down syndrome child. Or some say, oh, cerebral palsy, and the child doesn't have cerebral palsy. So there are so many of these medical conditions, and please avoid using labels that have not been given by a doctor. Avoid using labels when you don't know what the child has. Instead of, if you don't know what the child has, you can just say the child is a special needs child. At least that will cover almost everything. But the challenge is that I've come across, for example, on our Facebook groups or on social media, where there was a particular time a mom was actually saying a child has a particular chromosomal disorder. I think it's chromosome this either 13 or one of those conditions that children have. And she was really saying a lot about things and a lot about that condition. And then I asked the most basic of all question, oh, how did was the child diagnosed? This child has a genetic test, this child has a karyotype, and this child has never had that condition, karyotype test. And I answered the mom because there's a way mom said our baby had this and had that, and they say our baby has this particular condition at the same time. Automatically, if you're a developmental pediatrician, you know that conditions are not compatible. So children cannot have a genetic condition and also have cerebral palsy. Those two don't go together, okay? Because that's just how, if you understand those two conditions, you will know it cannot go together. So immediately the mom was like, oh, child has cerebral palsy, child had severe jaundice, but the child also has this genetic condition. No, that is almost practically impossible to coexist. So, I was really curious to know, as this child actually has this genetic diagnosis, and mom said no. So I said, then please stop saying your child has this condition, because your child has never been diagnosed with it. Your child does not have that particular it's one of the most basic of genetic tests we do, karyotype, to know whether there's an extra chromosome or not. And so if your child does not have that, then there's no way you could be claiming your child has that condition, because it can be quite misleading. And so there are many of these conditions. So for those of us in Nigeria and Africa, please avoid labeling the children when you don't know what is the condition they have. You can just say they have a special needs, but don't label them or call them any of the names, because that's the one you know, and just claim and using it for the children. I've seen a lot of that. I see a lot of people calling children Down syndrome, and I'm looking at the child. The child doesn't have Down syndrome. It doesn't look like a child with Down syndrome. But what they actually meant to say is that this child have a disability, and they just said that all disabilities Down syndrome. It is not. So we have cerebral palsy, which is separate from Down syndrome, which is separate from autism, which is separate from intellectual disability. I know it can be quite confusing, because sometimes some of our conditions can coexist. So a child with cerebral palsy can also have autism. A child with Down syndrome can also have autism. So a child with Down syndrome will also have intellectual disability. So we tend to have a lot of what we call comorbidities, like 2, 3, 4 conditions occurring in the same child. But we also know that some of them don't even go together. So I just want to encourage parents not to label their children until they've gotten a formal diagnosis by the specialist. We will get into that later, but I'm just telling us about those conditions that when children have them, they will automatically put them in the category of what we call special needs children. So other ones include congenital syndromes. There are many syndromes: Turner syndrome, Noonan syndrome. Of course, we've talked about Down syndrome already. There are so many of them that children can have. And most of those children also have some form of disability with them. Of course, the sensory impairment, hearing impairment, a child who cannot hear, who is deaf, or a child who cannot see, or what we call visual impairment, who is blind. Of course, learning disability, lots of them. And learning disability is different from intellectual disability. So learning disability tends to affect only maybe a particular area. So people who have dyslexia, they struggle with reading. Again, this is another area where people just messed up all the names, and everybody is saying I'm dyslexic, but they are not. What they actually have is intellectual disability. So most of the time we need proper assessment and proper diagnosis. Unfortunately, in places where we don't have enough trained professionals and specialists. A lot of people who are not really the right professionals kind of assume that responsibility, and then they begin to say, oh, we can test you for this, we can test you for that, and they begin to give labels and diagnoses, which are often causing a lot of confusion. I will go into that later, but I just want to say learning disability is different from intellectual disability. So in learning disability, it has to affect a particular aspect of learning. So the child's normal IQ or intellect will be normal, but they may struggle in some areas. So some children can struggle with reading, and that is dyslexia. Some is writing, or they have dysgraphia. Some people struggle with mathematics, and they have dyscalculia. Some people just think everybody is smart. There are some children that actually have a disability that make them struggle with doing mathematics. So they have what we call dyscalculia. So these are form of learning disabilities, or children with spinal bifida. Even when it has been repaired, they can still live some residual disability, and those children can also have special needs. Also, we have children with hydrocephalus, so those who have a lot, like very big head and due to a lot of much of water, or what we call the CSF, the cerebrospinal fluid, and also most of the time we try to correct them, but some of them either before the surgery or after the surgery they can still have some residual disability. Of course, attention deficit hyperactivity disorder is one of the most common one in school age children. Behavior disorders, conduct disorder, there are so many of them. So all these conditions, which is not an exhaustive list, by the way, but usually those are the most common ones. So children who have some of these conditions that we have talked about can we need some help, and we classify them as special needs children. All right. Before I continue, I just want to give us a little bit of statistics, like why we don't need to talk about special needs children, because they constitute a real big percentage of children that we see. And parents are struggling. Sometimes teachers are also struggling. And every week on Ask the Pediatrician Facebook group, I get a lot of questions about parents who they don't understand why their children are struggling at school, or the teacher has been complaining to them, and they're wondering, what do we do? How do I help my child? And most of the time, most of the children are actually special needs children that have not been diagnosed, and everybody does not know what is going on or what to do, because teachers just assume that when children come to school, they should just be doing everything they expect them to do. But some of them are surprised. Of course, some children special needs are so obvious, and so the teachers know, but there are some children special needs that are not, as we say in Africa, written on their faces. So you will see the child is looking perfectly like every other child, but the child's disability is kind of hidden. So then they begin to struggle, and the teacher begin to wonder, why is this child not able to concentrate? Why is this child not able to focus? Why is this child not able to talk? Why is this child not able to do this? So that is why it's so important that we understand that in every class, in every school, there will be children with special needs. And we need to identify, we need to be able to provide them the right support. So just some statistics from UNICEF, about 93 million children, 93 million, that's a lot of children. 1 in 20 of those who are 14 years old and below actually have some form of disability. So 1 in 20, so you gather 20 children together, at least one. Most classes have at least 30, 40 children in the class. So at least each class will have at least 2 children or more with disability. So that is how prevalent disabilities. And these are even children with moderate to severe. There are children that have mild disabilities, and sometimes people don't even pick those ones up because they kind of just fall under the radar, and they just kind of struggle or find their way, but because it's mine, people may not pick it up. But we're talking about children with moderate to severe disability. That is 1 in 20 children 14 years old and below have some moderate to severe disability. That's a lot of figure. And in Nigeria, in Nigeria, in 2013, the National Assembly, as part of, I think they were trying to pass the disability bill and all that, we found that there are over 20 million people living with disability. This, I think our population then may be about 200 million. So if 20 million of us are having disability, and I'm sure this is an underestimate, that is about 1 in 10. So that's 10% of the entire population have disability. So it's quite common, and I'm sure many parents are aware what I'm talking about. We don't even know the statistics. Some of us really have our children, and we know that they have some of these disabilities. So it's quite a huge population of children, like anything that's affecting 10 to 20% of the population, quite a lot. So we definitely need to talk about it, and we definitely need to know how to support our children who have special needs. And as I said earlier, the disability children may have could be mild, could be moderate, and could be severe. So you have children who have mild disability and they're completely independent. And then you also have children who have severe disability. And the other one are independent, sorry. And you have the one that are completely dependent on somebody else for everything. They need other people to take care of them, to feed them, to clean them up, to help them with every activity of daily living. So it's a huge spectrum, and that's why uh, sometimes parents try to encourage other parents, and then they are giving an example of their own child who has a mild disability. Of course, they will still use the same name, but you're referring to your own child who have disability, a mild disability, but to encourage somebody else who have severe disability, sometimes it doesn't always work, and other parents feel like, I don't think we're talking about the same condition here. Give an example, cerebral palsy. So I know people with cerebral palsy who are lawyers, who are doctors, and who are brilliantly doing well, who are completely living their life and not, in the, completely, you know, independent and successful in life, at least by the world, the way we classify success, they have a job, they marry, they have children, they're doing everything else any other person is doing. But you also have people with disabilities, with cerebral palsy, who are completely bound to their wheelchair, who cannot speak at all, who need somebody to feed them. Some of them are even on entry tube feeding. Like we have to pass like a tube into their tummy to feed them. And so that is another end of the spectrum. So we need to understand that disability can be mild, moderate, and severe. And sometimes parents are wishing, maybe, or hoping that their child sometimes are going to go from the severe hand to the mild hand. Unfortunately, sometimes it's not always possible for that to happen. We will talk about that later on as we talk about this condition. So the children with special needs are not a uniform group. I think that's the point I'm trying to make. It's not a uniform group. So it is not one size fits all recommendations, advice, or support, or sometimes when we share testimonies, yes, some children testimonies are fantastic, but some of them actually have mild condition, whereas some children are actually going to be severe, and for all their lives, they are going to need somebody to help them. So it's not an homogeneous group. We need to have that at the back of our mind, and so that we are sure we're giving them the right support. So I think for parents who are listening to me, I think the question you have is like, okay, I have a special needs child. How do I help my child? What do I do? So I'm going to spend the rest of the broadcast talking about how do you help your children with special needs. And when I use the word parents, I use that loosely, and I'm including that also teachers or family members, everybody who is in the life of a child with special needs. How do we help them? One thing we know is that children with disabilities and their families need help. Sometimes people think it's only the children that need help. No, it's not only the child that needs help. The parents, the families, the siblings, all of them needs help. So the special needs children, we have special needs parents, not because they have any special need, but because they have a child with special needs. So they are also special needs parents. and of course siblings of such children as well. All of them need support. So that is what we're going to talk about. How do we support? How do we help a child with special needs? Because remember the definition, children with special needs are children who definitely need help. And one of the greatest challenges the parents face is the fact that they are helpless with their child. As mothers, as fathers, one of the things we like to do is to take the pain of our children, to make things easy for them. And for parents who have special needs children, it can be very, very frustrating. They can feel so helpless, they can feel so powerless because they see their children going through these difficulties, and it's as if they can't do anything about it. So that feeling of helplessness can be so profound for families or parents who have children with special needs. Because it is a natural thing for most parents that we want to help our child, and sometimes, but we don't know how, or we don't even know what the problem is, and sometimes we just don't have the capacity, or we don't just even know what help this child needs. So this is what we're going to be talking about today. And sometimes people don't even know where to get the help, especially in countries that still developing, where these helps are not readily available, or where they are available, they are just ridiculously expensive. So this often leads to the parents themselves now developing their own special needs because they start having like mental health issues. They are discouraged, they are depressed, they are fearful, they feel all alone. Sometimes they feel they cannot be included. People don't want to invite them to their events. They feel like they can't go for other things because they just have to be with this child. And I'm also in a particular Facebook group, a special needs parents group, and I see a lot of mothers expressing this frustration on a daily basis, and I can understand what they're saying. It is quite difficult sometimes, not sometimes, I think most of the time, to actually be a parent of a child with special needs. So these children have special needs, these children need help. And parents are sometimes frustrated because they don't even know what the help the child needs, how to get the help, but yet they really know that they should help their child or they should help the children. So I will talk about those practical things like what can parents do? How do we help our children with special needs? But let's start first with why, because I think that's the number one question. And I see a lot of parents blaming themselves for their children having special needs. And whenever I'm answering questions, I always try, first of all, to deal with that guilt and tell parents most of the time it's not your fault that your child has a special need. So you don't need to blame yourself for a child with special need. And because you're already doing a lot trying to help this child, you don't want to add guilt to the midst of that complexity that you are already in as parents. So please don't feel guilty that your child has special needs. Most of the time, it's not your fault. Most of the time, it is not. I'm just going to talk. So when we talk about why the children have special needs, then you realize that sometimes it's not. It is, in fact, most of the time it is not due to you doing something wrong or anything. So you please do not blame yourself for your child having special needs at all. And when we talk about why the children have disabilities or special needs, some of these disabilities actually start, when the baby is in the womb, and some of them are issues that happen around the time the baby is being born, or some of them actually happen after the child is born. So we tend to divide it into causes that starts before the child is born and causes that starts after the child is after the child or during the process of labor and delivery, and causes that has to do with um, that happen after the child has been born. And the causes are usually multiple different causes. So there are sometimes the honest truth is that we don't even know why some children have the disability or why it happened. Sometimes they just happen like that. So this is again why, as parents, we don't want to blame serve for the child disability. So, like I said, most of the disabilities happen before birth. Some of them happen during the delivery process. Some of them happen after the delivery process, and they can be due to multiple factors. Most of the time, you have no control over this factors. Sometimes they are just random events of nature. So we don't always have the answers. I know parents always come to us as a developmental pediatricians and they were like, Doctor, why? And we try to always find the why as well so that parents can have closure so that you don't have to blame yourself. But the honest truth is that sometimes we will never know why and we don't have the answers as well. So we just have to accept that. So acceptance is also very important when we talk about special needs children. So let's talk about the common causes. Let's start with first about the causes that things that can happen before a child is born that can lead to that child having special needs or disability. The first one, the most common one is genetic. So when a baby is being formed, the the egg of the mother and the sperm of the father, each of them carry what we call chromosomes or genetic materials mixed together to form a whole human being. That process is completely very intricate process. The rights, the head must have the complete chromosomes that are okay. The sperm must have the complete chromosome 23 that are okay. They must meet together, fuse together, and they divide severally to form the human being. That process, anything can go wrong during that process. And if anything goes wrong, it can lead to a child having disability. For example, most of the children with syndromes like Down syndrome, for example, in a simplified form, we say they have extra chromosome 21. So ideally, we should have one chromosome 21 from dad, one chromosome 21 from mom. But sometimes, for the egg to be formed, it is a whole cell that divide into two that form 23 here, 23 there, because a whole human being, most of our cells are 46. So if for any reason, instead of one to go into each of the two side that's being formed, two of them decide to go to one place and the other side does not have any, then you can have a child. So maybe the egg or the sperm will have two of the chromosome 21. And of course, when it meets with the other, either the sperm two or the egg, and that one has one, that becomes three instead of two. So you now have three chromosome 21, what we call trisomy 21, and that can lead to Down syndrome. It can also affect chromosome 18, trisomy 18. You can also have a chromosome 13, what we call trisomy 13. And all those children will have genetic condition. That's just an example. There are so many genetic conditions, so many of them. We have Turner syndrome. We have so many of them, and sometimes in the gene is because something is missing. For example, in sickle cell anemia, the particular gene that's supposed to produce a particular amino acid for the hemoglobin, something is missing, and so that is not produced, and that is what leads to that hemoglobin sickle cell anemia. Although it's not a special needs, but it's just an example of genetic conditions that trying to talk about. So if anything goes wrong in the genes, a child can be born with congenital abnormalities, or the child can have special needs. Sometimes what goes wrong is so bad, the nature aborts that baby that this one is not compatible to live. But sometimes the baby can live, but they are going to have disability. And most time as parents, you have no control over your genes. But sometimes you may already have those genetic condition that you can pass on to your own child as well. So sometimes when we pick up children with genetic disorder, then we want to test the parents and we want to see whether you also have a genetic condition that is causing that you have passed on to the baby, and that is what's causing disability. Sometimes some parents are what we call carriers. You have that gene, but you don't have any disease. But when you pass it on to your baby, maybe another person also passed similar gene to the baby, then the baby actually now have the condition, and that's maybe surprising to parents, but parents may have been a carrier of the gene and the pass on to the baby. All right, so these are conditions that can happen when baby is being formed and they can lead to a child being born with special needs. Another common condition is infections. So infections for a mom who is pregnant, there are lots of them. We have what we call the torches, toxoplasmosis, rubella, cytomegalovirus, herpes simplex, and all of them. Syphilis, if they happen to the mother, most of the time the mother herself may not be very sick, but if a mom is pregnant, especially in the first trimester, and that infection, most of them are viruses. One of them is a protozoa. They pass on to the baby in the womb. They can cause lots of harm to the baby. So that baby can be born with lots of disabilities. Some of them will be deaf. Some of them will be blind. Some of them will have cerebral palsy. Some of them will not have anything, but some of them will have disabilities. So infections, what we call the congenital infections, infections that affect the mother in the womb, can um, lead to the child having disability. And sometimes mothers don't even know they have this infection because they are well, but it happens. And unfortunately, when baby is born, that will now see the effects. Sometimes the process of baby being formed in the womb is a very intricate, very complex process. Things are being divided, things are being grouped together. So sometimes in that process, many things can go wrong. So things may not be formed properly. Or some things may be lacking. For example, if the mom is not taking folic acid in the that first few weeks of pregnancy, especially, the folic acid is important for formation of all the various organs and all that. So if it is deficient, so mothers could have a baby without no brain being formed, or a baby with some abnormal formation of the what we call the neural tube, and which can lead to spina bifida and so many other things. So these are also conditions that can lead to such babies now being born with malformation, and they can end up having disability. Also, some behaviors of parents. This is one part where a parent can actually blame themselves. But like I said, you can see I've mentioned several things which you have no control over. But there are some habits of parents too that can actually affect your baby and can lead to disability, like mom taking alcohol. I get a lot of questions about mom asking us, can I just take like a sip or like one bottle of beer or palm wine? There is no safe level of alcohol in pregnancy. No alcohol, not even a drop should be taken, because there's no safe level. There's no level you would take as, okay, this is not what is too much. You don't need to drink a whole bottle. You don't need to drink every day for you to have a child with fetal alcohol spectrum disorder. So no alcohol in pregnancy, mothers taking alcohol in pregnancy, or taking drugs like all those so-called recreational drugs. They can also affect the baby. Cannabis, heroin, cocaine, they can affect the babies, and such babies are actually born with special needs. They will have learning disabilities, so many all sorts of complications, and then they can have disabilities. So this is one area where parents need to make sure they don't have to blame themselves. So no alcohol, no smoking in pregnancy, no use of recreational drugs in pregnancy, including smoking, because it can affect the baby and it can lead to the child being born with special needs. Now let's talk about what are the causes that can happen during delivery or after delivery. The delivery is very important. So it's so important that we don't miss things, don't get wrong. And sometimes babies are well formed in the womb, and during the time of delivery, that is where things go wrong and can be very, very sad. So babies that are born too early, babies that are born before 37 completed weeks, we call them preterm babies. Prematurity, it's really those of them that are very tiny, less than 32 weeks, less than 1 kilograms. They are very high risk for multiple complications like cerebral palsy, so many possibilities that can happen. So this is why we don't want premature babies. This is why we want babies we born at time. We try to keep them in as long as possible, but sometimes they just happen. So but we need to be aware that such babies are at risk of having disabilities. Okay, also during delivery, when that's why we want you to deliver in a good hospitals where they can monitor your baby. If baby is too stressed, and the baby did not cry when the baby is born, what we call birth asphyxia. It can also lead to children having disability like cerebral palsy and intellectual disabilities, convulsion, epilepsy, and all the rest. Or sometimes the baby is too big and they were trying to force the baby through normal vaginal growth. That baby can come out with injuries, bad trauma. They can lead to children having disabilities. So things like Epilepsy palsy, and that child will lose control. Sometimes the hands, they may not be able to use it properly. So that could also lead to special needs. Or after the baby is born, things like jaundice, severe jaundice. That's why when you come to it, if you always say you jaundice is an emergency, but I see lots of parents, when your children have jaundice, they're just giving purple water, or they're just saying, oh, let's just do naming ceremony first. The jaundice will go away, or they're using herbal remedies. And I always tell parents the jaundice is going to go away anyway. Jaundice is going to clear. But the issue is that when jaundice has gone, what has jaundice done before jaundice left? Jaundice has caused brain damage. So if jaundice is so severe, some babies, see, that's a challenge. Some babies will have mild jaundice, and whether their parent comes to the hospital or not, baby will be fine, okay? But some other babies will have severe jaundice, and so the other people that their baby have mild jaundice and they think this is the purple water that they gave that work, which actually is because the baby just had mild jaundice and was lucky and was fine. We advise the parents, other parents also go and do the same, but their home baby have severe jaundice, which is causing the brain damage, and then the outcome will not be the same. So when the baby has jaundice that we have to be taken to the hospital, we cannot say it's mild or severe until we take a blood sample, and then we can now decide to run a test on it, and then we can give advice. So if it is mild, then of course we tell you to go home. But if it's severe, we're going to treat the child. Sometimes we have to put the child under phototherapy. Sometimes we have to exchange the baby's blood. And I see a lot of parents, because everybody just wants to do naming ceremony. They don't want to come to the hospital when the child is 8 days old due to the culture. And at the end of the day, they come to us, baby is already having convulsions, maybe is already having brain damage because of the severe jaundice. And at that time, there's nothing we're going to do. The jaundice will still go away anyway, whether we do anything, but the child has now developed a disability. So these are conditions that can lead to special needs children, or children who have severe infections after they are born, or in the first 1 month of life, they have meningitis, encephalitis, infections in the brain. It can cause severe complications in future, and such children will have special needs. Or exposure of the baby to toxins like lead. In Nigeria, a lot of people like to put this tiro or on baby's eyes. That zero is very high in lead. So please, whenever I see babies and on Facebook and mothers have put all this zero in their eyes, I just scream. Please don't do that. You're just putting lead, and lead is a neurotoxin. It just damages the nerves, the brain, and that baby can end up having disability. So these are the things that can lead to disability. Sometimes, like I said, we don't know, and there's nothing we can do about it. So now, how do we help these children with disability? So we've talked about what can cause it, and then let's talk about the help that they need. I really took my time to talk about the causes, because sometimes from the causes, you already know some of the solutions, and in terms of prevention especially. But in terms of help, there are help for the child, there's help for the family. What are the help for the child? The number one, the child needs to have a diagnosis. Like I said, a lot of children have special needs, but nobody even knows what is the diagnosis. And I see a lot of questions like that, and I always tell parents, the first thing you need to do is to take the child to the hospital. We need to know what is wrong. And sometimes parents expect you to know what is wrong because they've written 2 or 3 lines. The truth of the matter is that parents only focus on what you think is wrong. But when a professional sees the child, we see everything else. So there are some things else that are wrong that parents are not even worried about. For example, parents may be worried about the child is not walking, but they are not worried about any other thing. They are not worried whether the child can see, whether the child can hear, So it takes a professional to do all those kind of assessment. Or some children are walking, then parents are only worried that they are not talking, but they are not worried whether the child is using their hands and all those kind of things. So it takes a professional to do that. So that's why the first thing is diagnosis. some conditions could be treated, some conditions can be treated. Some conditions cannot be treated but can be managed. So some conditions, like if a child is having epilepsy, we can give drugs for epilepsy. But if a child is having difficulty with walking or with talking, that child will need therapies. So physiotherapy, speech therapy, occupational therapy. Children also need psychological support as well. Of course, school education is so important. And of course, inclusion. We don't want any child to be isolated or left out of what all the other children are doing because they have a disability. The mantra now is inclusion, participation. Everybody must be part of everything, and disability should not limit the children. So let's start. I'll just run through this. Early diagnosis. The earlier a child is diagnosed, the better. Most time, mothers always have this very good intuition. They always know that there's something wrong. They are not developmental pediatrician, but they do developmental assessment all the time because they're always comparing their child to other children, the cousins or their friends' children that were born around the same time. And oh, my child is not doing this child is already doing that. So they know, or if they've had other children before, oh, when baby A was born by 1 year, it's already working. This is baby B now, it's almost 1.5 years, the child is not working, there's something wrong. So parents are very good. So at picking up when things are not going right, and the most important thing is not to wish it away. The most important thing is to seek diagnosis, and it's better to come to the doctors and let us tell you, okay, there's nothing wrong, rather than for you to come to us late and then we say, oh, we wish you have come 2-3 years earlier, because early diagnosis will lead to what we call early intervention, and early intervention helps. So please, if you pick up any, we've talked about developmental milestones before. So if you are just listening to me, you can look at the past episodes on the YouTube channel, on my podcast, just look for developmental milestones. So you will know what are the normal milestones. And then we've talked about when there are delays. So if you notice that your child is delayed in any area, please do not just think, majority of people always tell parents, don't worry, the child will do it later. I always tell them, don't take this kind of advice. You must go to the pediatrician. They must assess the child. Unfortunately, sometimes some doctors also tell parents the same thing and tell parents, oh, don't worry, your child is just been late. Oh, boys don't talk on time. Oh, girls don't work on time. Don't take this kind of generalistic reassurance. They must see your child. They must assess the child. So the best thing is to see a pediatrician for proper evaluation. If you ever have any concern, because like I said, parents, you are very good with your intuition. If your intuition tells you something is wrong, 99% of the time something is wrong. So please go to the hospital. Let the pediatrician, let them do a proper evaluation. Let us know what is wrong. Let us counsel you, and then let's take you recommend intervention. You may have to go to hospitals that are more specialized settings, like tertiary hospitals, because sometimes it is not every doctor that can handle children with special needs. So you may want to go to a hospital where they have all the various specialists in one location. And so that is appropriate. So treatments, like I said, if there is treatment, we can treat. For example, if it has hydrocephalus, we can do surgery. We can put in a shunt and we can treat that. We can repair spinal bifida. We can do a lot of things. So some children will respond to drugs for like seizures and things like that. But some children will need therapy, like child is not working, any physiotherapy, or some children will need things like speech therapy if they're not talking on time. Some children will need occupational therapy with their fine motor skills. Some children will need hearing aids if it's hearing problems. Some children will need glasses for their visual impairment. So, but you need to come to the hospital and then we can provide these therapies. And usually good doctors will also tell you about appropriate education setting for your child. So some children can go to mainstream school, and we try to make sure as many children as possible that can cope can go to mainstream school. But some children actually need special needs school, depending on their level of needs, depending on their cognitive ability and all that. So, and some children are not really school, like they may not be able to go to like what we call the traditional schools. Some of them may just have to go to like maybe centers where they just learn basic activities of daily living and all that. So there are different special schools, and we actually have what we call special needs school. But for children that can cope in the regular traditional mainstream schools, we try to include them. But for where they cannot, then they may need to be placed in a special needs school. But that's the job of the pediatrician, the special needs educators, the educational psychologists, to know what is the best setting for your child. And of course, sometimes support group is very important. You can never emphasize this. Like I said, it's a lot of pressure that parents who have special needs children are going through, and so they need that support group, and so support group for the children are available. Support group also for the parents and for the siblings are also available. And for parents and siblings, there are other support that you need. You need the spiritual support. So please make use of your pastors, your religious leaders. You need your family members. So don't hide those children away. Let everybody know that this child is part of this family. Child may have special needs, but still a member of the family, and everybody should support them. Grandparents, siblings, everybody needs. If you think you are struggling, you may need to see psychologists. Sometimes I find out that when you see other parents who have gone through that same challenges, they are usually the best psychologists because they've gone through what you're going through, and they can share with you their own experience. And some of the things that look like mountains to you now, they've gone through it, so they now know this is going to pass, so you don't need to worry. And they can encourage you. They can share with you what has worked for them or what does not work for them. We have a lot of support groups. Thank God for social media. Even on Facebook, there are a lot of support groups for parents with special needs. There are some that are general, and there are some that are like specific, like autism support group, like cerebral palsy. So you may want to plug into those support. Ideally, the government should be supporting also financially, because sometimes parents have to lose their job so that they can take care of their special needs children. In some countries, they actually give what we call disability grants and all that. I know we're not yet there in Nigeria, but we're hoping that we'll get there very soon with the disability bill being passed by the National Assembly and all that. So these are the supports that your child that you need. Of course, when it comes to the special needs your child have, you have to be the experts. You need to know a lot about that condition. So if you're a parent who have a child with autism, you need to know a lot about autism. Or if you're cerebral palsy, you need to know a lot. There are a lot of parents and books. There are a lot of thank God for internet. There are lots of materials online for parents to support you so that you can be able to advocate for your child. Make sure that your child gets all the support, because like I always say, parents are your child first. Therapies, advocates, everything. So you need to get all that. As we round up, I was trying to make sure that I fit in everything into this one session, but I guess if you still have questions, I can always come back later and address them. There are a lot of challenges that parents and families of children with special needs will face. There's burnt out, there's caregiver fatigue, depression, stigma, especially in our culture where we just, people don't understand special needs, and then they just begin to look at those who have special needs children as if they are different. Some churches don't even want the children in the church because, these are really not right. These are things we need to correct. Financial challenges I've mentioned that sometimes these special needs children leads to marital, because there's a lot of stress on that marriage, and sometimes some parents, some mothers have lost their husband. I've seen husband who told their wife to go and kind of kill the child, like go and dump the child in the village. Very horrible things. But this thing sometimes it's a break of marriages, and lack of support by extended family. Even parents blaming. People will blame the mother or blame the father or blame. Which is not really, like I said, it's not the fault of the parent that the child has special needs. And of course, sometimes there's even no facilities, no therapists, no specialists where we live. So what do we do in this setting? So practical steps as I round up. What are the practical steps to help your children with special needs? Number one, you need to get the help you need. You need to get the diagnosis early. Then you need to be informed, be informed about the condition, know what to expect. Because I find that most parents are always disappointed because when they come to see us, and that's what I try to do when I see parents, I try to actually just sit down for the first day. I just want to talk to you through the whole thing and just talk through everything. So because I think parents just need to understand, we try to give you hope, but we also want to make sure that the hope is realistic and so that we get all of that right. So you need to have, that kind of honest conversation and accept it, because sometimes the honest truth is that there's nothing we're going to do to fix what has happened. We're only trying to just help the child's life, to be comfortable, for the child to get the right support in the right places. Please seek help in the right places. So a lot of people, charlatans, also make which is very sad, really. They take advantage of parents because parents are so desperate. Somebody tell you that this supplement, if you give it, everything is going to disappear, and then they give you, and they're so expensive, and parents just fall for those scams. And I always tell parents, whether in medicine we do what we call evidence-based. So if you tell me something works, I'm going to go and use it, and then I'm going to compare it before and after, and then that's when we say it works. We would not just claim something works. So everything has to go through what we call the due process of research, clinical trials, and all that. But a lot of people that are doing these scams, they will just tell you everything works, and they will make it sound like it's a cure. And like, if we have that cure, we are also happy to have it. We'll be using it. So if the doctors are not recommending it, it means it doesn't work. It means there's no evidence that it works. So please, there's nothing wrong with seeking spiritual help and prayers. I am a Christian. I also believe in miracles. I believe God can, intervene. But please seek medical help along the way as well, because sometimes God answers our prayers in different ways. God can do a miracle like healing the blind and make the eyes to see, or the deaf and make them to hear. But sometimes some children don't have those kind of miracles, but God gives you the capacity, the power to be able to support your child. All right, so I think I'm going to stop here. I think I'm still going to come back and do part 2 of this, because I've not talked about prevention, and I think that's, for me, is very important. And I've not talked about some other professionals and what they do. So I'm going to pause there because it's almost 1 hour and I've been talking. With the talk about special needs children. So next week I will conclude, and next week I'm going to conclude by talking about how do you take care of yourself, and I'm going to talk about how do we prevent disabilities, and I'm also going to look at what are the myths that are commonly associated with disability, and we're just going to demystify all those myths as well. So thank you so much for listening, and watch out for the second episode, the concluding part of this particular topic. And like I said, if you have any questions, feel free to send it to Ask the Pediatricians Facebook group, or email askthepediatricians@gmail.com, or just send it through to Fresh Waves Radio WhatsApp number, and then we'll be able to address them. Maybe when I come next week, I'll address those questions first, and then I will give the concluding parts of this episode. Thank you so much for listening, and I'll see you next week. Bye.